to bring Republicans and Democrats together for real solutions. As President Kennedy once said, let's not seek the Republican answer, let's not seek the Democrat answer, but let's seek the right answer. We know that Obamacare is the wrong answer. I thank the gentlelady, and I yield back.
I thank the gentleman for doing so. We have with us the chairman of the Republican Study Committee, Mr. Steve Scalise from the great state of Louisiana.
I'll thank the gentlelady from Minnesota for her leadership on this, claiming this time, but also for all she's done to point out. And I think, Mr. Speaker, more and more, as every day goes by, more Americans are finding out just how devastating the President's health care law is to their families. If you look across the spectrum, and the President likes mocking Republicans who have said, we want to stand up and find a better way. We don't think this law is workable. We've had 41 laws the President's bragged and mocked. He said 41 laws to repeal or defund portions of the law. You know, Mr. Speaker, President Obama himself has actually signed 7 of those bills into law. President Obama has recognized his bills so unworkable that he issued 1,400 waivers to his friends who could find access to the White House. Then he said, okay, the employer mandate's so bad, I'll give a break to big businesses because it's so unworkable. Then just a few weeks ago, President Obama himself, Mr. Speaker, said that he was going to actually go and give a big break to insurance companies. But you know who he hasn't given a break to yet? American families. Hard-working American families deserve the same relief from the President's health care law that he has granted time and time and time again to the privileged few who can get access to the White House. That's not how democracy is supposed to work. That's not how health policy is supposed to work. This law is so unworkable that the heads of labor unions, including James Hoffa, of all people, has said that this bill, the President's health care law, will be a disaster to middle-class working families and will destroy the 40-hour work week. That's a foundation of our nation's economy. We want to give that same break to him. We want to give that same break to all American families, and that's what this fight is all about. It's a fight to ensure that government continues to get funded while also providing the same relief from the President's health care law that he already has said he wants to give, but just to the chosen few who can get access to the White House. If it's so good for everybody, it should apply to everybody. But if it's so bad, it shouldn't be Swiss cheese holes that you carve out to exempt your friends. It should be an exemption for all American families. That's what we're fighting for. Again, I thank the gentlelady from Minnesota, and I yield back the balance of my time.
That's a wonderful rendition, and I appreciate the gentleman from Louisiana. We now have Representative LaMalfa from California's 1st Congressional District.
I greatly appreciate the gentlelady from Minnesota for her efforts here and for the great lady she is. And Mr. Speaker, again, here we are discussing an issue where this is taking away choices from American people. Now, as promised, we saw the President himself say, if you like your health care plan, you'll be able to keep your health care plan, period. No one will take it away. One of my colleagues on this floor yesterday, counter to that, said how he had his plan canceled as of the end of this year. People all over this country are now starting to get cancellations on their health care insurance plan that they've chosen with their families around their kitchen table, probably agonized over on how they decide they're going to afford it, what level of deductible, what kind of coverage they're going to have, and that's being swept away by what really feels to a lot of people. A lot of my constituents are telling me it feels like a very oppressive plan that's being pushed upon them. It's really unbelievable in the United States of America that you can be forced into being as part of this system. It blows my mind that the Supreme Court would agree and rule that people should be forced into purchasing something of this personal choice. We were talking a little bit earlier about how people's privacy is going to be so greatly affected by all this information being dumped into a pool, and government bureaucrats are going to be in charge of that. Look at the leaks we've already seen with other people's information being leaked out by the NSA or things accidentally put on the internet by who knows, all the different agencies involved. Yet this is going to manage 1/7 of our economy and a very important, very personal thing with people's health and their families' health care. I'm really, really shuddered to think what if this measure cannot be slowed down or stopped by the efforts we're doing in the House and in the next few days around here, it's going to be devastating to people's personal choices, to the economy, to their jobs. Look at the part-time jobs that are being made out of full-time jobs because people have to react. There are true costs to what the Obama health care takeover is going to do to the people of this country, their families, their livelihood. So that's why we dig in so hard to do this. This isn't politics for us. No, it isn't. It's about doing the right thing for the American people. A document that really was not well read or well vetted, done here just about 3 or 4 short years ago here, now is coming home to roost in its ineptness, in its incompleteness, and the overall oppression it's causing for Americans who are feeling that they're out of choices. In my own home area, for example, people had up to approximately 130 different choices of health care plans through 8 to 10 different providers. They'll be limited to 2 in my part of Northern California, with maybe 8 to 10 total plans that they can choose from. And the way this is rolling out right now, you might get only 1 plan if you're in certain sectors for perhaps a full year. How is this improving anything? How is this making health care more affordable, more options, more anything? We've got to repeal this. But in the meantime, at the very least, we ask our colleagues in the Senate to not strip out the provision we put in place that would allow for a 1-year delay, which is the least we would need as a country to see something made better than what it is right now. Exemptions, one after the other, are being dropped on us. And why do people want exemptions that work in the public sector if this is such a great plan? And pretty soon there'll be nobody left in it except for the taxpayers themselves. So I thank you for the time. I thank my colleague, Ms. Bachmann, for allowing this time here today. And let's do the right thing here the next few days in this Congress. I yield back.
Thank you, Representative Amalfi, for all of your hard work on defunding and delaying Obamacare. We have next with us Mr. Culberson from Texas's 7th Congressional District, who has been tireless, especially in the area of keeping government fully funding. I yield to the gentleman for 2 minutes.
Thank you very much. Mr. Speaker, I think it's important for the country to know that the House of Representatives has done its job in passing the most important appropriations bills to make sure that our military is fully funded, that our veterans are taken care of, that the essential functions of Homeland Security are taken care of. In fact, we passed those bills, the defense bill out of the House on July 24th. The Homeland Security bill was passed on June 6th, and the Military Construction and Veterans Appropriations bill was passed on June 4th. We've also passed out of the House the Energy and Water Appropriations bill, and the Senate has been sitting on these bills for over 90 days. Mr. Speaker, the President has very few responsibilities set out in the Constitution. One of those specific responsibilities is Commander-in-Chief. And it's been reported that the President recently said that the troops in the field might not be paid unless the CR was passed. Well, the Senate has had these bills for over 90 days. And I think it does not, how does that reflect on the office of the President for the Commander-in-Chief to say that the troops are not going to be paid when, in fact, we've already passed the legislation out of the House and the Senate's been sitting on it for over 90 days to make sure the troops are paid. We in the House of Representatives, the constitutional conservative majority in the House, are keeping our word to the nation and to our constituents to do everything in our power to defund, repeal, delay, whatever it takes to stop the most destructive piece of legislation ever passed by this Congress. And I don't think it should be called Obamacare. It should be called Democrat Care, because it was done with 100% Democrat support. Not a single Republican voted for it because we recognized the damage it would do to the economy and to our magnificent health care system. The Democrats passed this bill on their own, and all of a sudden they're discovering as the asteroid enters the atmosphere, they've got a big problem because it is causing doctors to leave the profession. It's driving up the cost of health insurance premiums. It's raising deductibles. People are losing their health insurance and being dropped into these non-existent exchanges. One other problem that I just discovered and that no one is, I think, aware of yet are nonprofit organizations who have been lifting people out of homelessness or addiction and giving them job skills and training them, and they find local employers that are willing to take these folks and give them a clean slate, a fresh start, and a new job, and it would wipe out any convictions they've had. They wipe out any history they've got of drug addiction. These nonprofit organizations have suddenly discovered that the employers are pulling up the drawbridge, because all of a sudden the employer could be faced with he's got to decide as an employer, do I have to provide health care coverage for this essentially volunteer, this worker who was previously homeless and had no job skills, and could be fined for every employee in the company. So the disasters continue to unfold. It's urgent the House of Representatives, we will all, I know, stand together and working and doing everything we can to repeal, delay, defund Democrat care, and using every legislative tool at our disposal. And I thank the gentlewoman from Minnesota for the time.
I'm extremely grateful to Representative Culberson. I know his daughter Caroline is the most precious part of his life, as our daughter Caroline is as well. And as a gentleman from Texas, I know it's his daughter that he's most concerned about with the ill effects of this bill. And I also called now on another great Texan, Randy Weber, from the great state of Texas, from the 22nd District of Texas. Mr. Weber, you have 1 minute.
Thank you. I thank the gentlelady. Mr. Speaker, 4 facts, 1 question. Fact 1, Obamacare passed the House by the House Democrats, 219 of them. Now, 34 Ds joined Republicans in opposition. Let us see how many join on funding the government with the upcoming CR. Fact 2, Republicans are poised to fund everything in the government at the current levels and eager to do so. Fact 3, polls show that Americans overwhelmingly do not want Obamacare. Fact 4, this House of Representatives is the keeper of the purse as designed in the Constitution and well within our authority to defund the ill-conceived and very unpopular government takeover of health care. Only 1 question, Mr. Speaker. Will those same Democrats that voted for Obamacare vote with the American people this time, and will the Senate vote with the American people this time? I'm Randy Weber. That's the way I see it.
I thank Randy Weber from Texas. Texans have stood up on this issue, and they've been fighting from the very beginning. But there's also another member who's a new member of Congress, Mr. Kerry Bentivolio. Kerry Bentivolio from Michigan's 11th District has diligently worked not only to defend Obamacare, but to delay Obamacare. He ran on that when he ran for office, and he has fulfilled that promise while he's been a member of Congress. I yield to the gentleman of Michigan's 11th District, Mr. Kerry Bentivolio, for 1 minute.
I thank the gentlelady from Minnesota. That's to defund or delay. Mr. Speaker, the President's health care law is unworkable. Hardworking Americans know it. They're going to see their insurance premiums skyrocket. Small business owners know it. They're going to have to scale back hiring and maybe even let people go. People in the President's own party know it. Even Senator Baucus from Montana, a key author of the legislation, called it a train wreck not long ago. The unions know it. Teamsters James Hoffa calls it a nightmare because of the jobs and benefits lost. Why? Because despite the President saying the law is working the way it's supposed to, we know it's not working at all. That's why House Republicans remain committed to protecting the American people from this unworkable, unfair law. With that, I yield back. Thank you.
I thank Mr. Benavides. We have now Scott Tipton from Colorado's 3rd Congressional District, a fabulous member of Congress.
I thank the gentlelady for her leadership. Mr. Speaker, the Affordable Care Act missed on its primary goal, addressing affordability and accessibility for the American people. Probably no one said it better than the AFL-CIO just a few weeks ago, saying that the Affordable Care Act will lead to the destruction of the 40-hour work week and devastate the health and well-being of their members. There was a time in America when we worked to be able to get a 40-hour work week. Now Americans just want to have a 40-hour work week. We know there is a problem with health care law when we're seeing fewer doctors, fewer nurses, fewer hospital beds, but yet we have the room to be able to create more IRS enforcers. This is legislation that we are reaching out to the administration to be able to work on. To be able to create affordability, accessibility, we must defund and replace this broken piece of legislation on behalf of the American people. With that, I yield back.
Thank you, Representative Tipton. From the Rocky Mountains all the way to the great state of New York, Mr. Tom Reed, a fabulous member of Congress from New York's 22nd Congressional District. I yield 1 minute.
Well, I thank the gentlelady for yielding, and I came here today on the floor of this chamber, Mr. Speaker, and I just dropped the FAIR CR. And what the FAIR CR says is, let's listen to the American people. Let us delay Obamacare for at least 1 year. The President has already given business a pass for 1 year. Why is it fair that individuals and hardworking taxpayers have to be subject to this mandate? Also, what's fair is why are there special exemptions for members of Congress and employees and staffers here in Washington, D.C.? You got 300 other million Americans have to be subject to this law. It's just not right. It's just not fair. It's time to keep the government open, but do what's right and listen to the American people and take care of this unfair policy that the administration knows needs to stop. Thank you, and I yield back my time.
Representative Tom Reed has gone to the heart of this problem, which is the lack of fairness in Obamacare. And speaking to that is Representative Ted Poe of the great state of Texas. After myself, my mother's favorite member of Congress is Ted Poe, our hero. I yield to the representative from the great state of Texas.
I thank the gentlewoman, and I thank your mother for being so kind. I appreciate the fact that you're bringing this to the attention of the American public and to members of Congress again. The Affordable Care Act, it's not affordable, and has nothing to do with care. We cannot afford it, and the health care of the nation now turned over to the government. Are you kidding me? And that's why we are so persistent in trying to change a bad decision by Congress, the Affordable Care Act. So this morning, I asked people that are on my Facebook to answer this question. How is Obamacare affecting you and your business? Share your story with me. Well, I got a lot of them, and I can't give them all today. I ask unanimous consent to file them in the congressional record.
Without objection.
Thank you, Mr. Speaker. Here's what Stan says. I lost my job and had to take one with lower pay, no insurance. Result of Obamacare. Carolyn, my husband's insurance increased 162%. Now, the gentlelady from Minnesota knows these are real people. These aren't statistics out there in the fruited plain. These aren't theories about the president. These are real people who are affected by the president's signature legacy nightmare law. Ray says, my family didn't get a congressional exemption. Can you get me one? Ray, good point. Members of Congress ought to be under the same laws as everybody else in the country. Everybody ought to be under Obamacare. And he brings out a good point, and I have here 729 of exemptions of over 1,200 that were granted by the President for waivers of Obamacare. I'd have had all 1,200, but the copying machine ran out of paper, so I couldn't print them all. But here are 729 special folks, special treatment, better deal, because they're not under Obamacare. They get some kind of waiver for implementation of Obamacare. And Ray is right. It's just not right. It discriminates against everybody else. This great law gets to apply to everybody except some special folks the President gives waivers to, at least 729, and I ask unanimous consent to put these in the record.
Without objection.
I will continue. After Ray's comment about a congressional exemption, I can't get you one, Ray. You need to call the President. Michael says, I have to postpone my graduation from the University of Houston because I cannot take the courses I need due to having to work to pay for mandatory health insurance. Tanya, my family's insurance premiums have tripled since Obamacare was signed into law. I'm not sure how much longer I'll be able to keep insurance. Tanya's tripled. Pam, the huge chemical company my husband works for has made changes to his benefits, which include higher deductibles, co-pays, and loss of prescription drugs, all done in anticipation of this new law. Please help. I ask for one more minute.
The gentlewoman's time has expired.
I thank the gentleman from Texas, Mr. Ted Poe, Judge Ted Poe, because what we are fighting is to make Obamacare equal for all Americans, and I yield back.
Members are reminded to address remarks to the chair and to refrain from engaging in personalities with regard to the President. Under the Speaker's announced policy of January 3, 2013, the gentlewoman from Florida, Ms. Wilson, is recognized for 60 minutes as the designee of the Minority Leader.
Mr. Speaker, we're making a modest little change. I relinquished that 1 hour to Frederica Wilson. I reclaimed it. We're going to talk here for the next hour about...
Under the Speaker's announced policy of January 3, 2013, the gentleman from California, Mr. Garamendi, is recognized for 60 minutes as designee of the Minority Leader.
Thank you, Mr. Speaker. Sorry for the confusion, and my apologies for that. We've just heard a remarkable hour of problems that really were so overblown as to be really not worthy of much discussion. But I think the American public really needs to understand what this last hour was all about. In fact, the Affordable Health Care Act is working. And it's actually working very, very well for millions upon millions of Americans. I just want to read some facts and then move on to what is really going on here, which is an effort to try to leverage the necessity of funding the federal government. That is something we must do every year to provide the money to continue all of the work of the federal government. They're trying to use that as a lever to gain something that they've been unable to do in a presidential election year. Last presidential election year, the issue of the Affordable Health Care Act was front and center. And the American people heard more than a year of debate about the Affordable Health Care Act, whether it was good or not so good, all of the benefits and all of the problems that it might be. And at the end, November of last year, the American public decisively said that the Affordable Health Care Act and President Obama should continue. That was the decision by Americans. And in the House of Representatives, we gained seats on the Democratic side, and I think about 2 million more Americans voted Democratic than they voted Republican, although because of the redistricting and the gerrymandering, the House remained in Republican hands. Now, just understand what's going on here. What could not be achieved in the democratic process of an election is attempted to be achieved in two absolutely critical moments in the annual processing of the federal government. The first moment, it comes up on October the 1st, the necessity to provide money to carry on all of the tasks of the federal government. Social Security Administration, the national parks, and on and on. Every aspect of the federal government has to be refunded, or nearly every aspect has to be funded every year. That is a moment that is now being used as a lever to try to achieve what could not be achieved in an election. After all, as America, this is a democracy. We make our decisions through the electoral process, not by trying to lever, using a critical moment, basically the funding of the American government. Now, in 2 or 3 weeks beyond October the 1st, there will be yet another moment of critical importance, and that is the ability of the American government to continue to pay its bills. It's called the debt limit. Heretofore, well, actually until 2011, this was a routine process in which the Congress would continue to say, okay, we will increase the debt limit so that we can pay our bills. It was done during Democrat and Republican administrations routinely. There was always some discussion about the debt and about the deficit, and as it should be. And in fact, the President, Mr. Obama, when he was in the Senate, railed against this issue of deficit. Oh, now he's on the other side of it? Okay, that often happens. But the fact of the matter is that in this process, these two moments of time are now being used as a lever to achieve in the legislative process what could not be achieved in the electoral process. So much for democracy. Now, just a few facts about the Affordable Care Act, or Obamacare as it's come to be known. Nearly 13 million Americans have benefited from over $1.1 billion in rebates from insurance companies. I was the insurance commissioner in California for 8 years, and I knew then, as I know now, that the insurance companies were overcharging the public for their health insurance policies. However, I did not have any authority under California law to order rebates. The Affordable Health Care Act sets up a system that requires the insurance companies to pay at least 80% of the premium dollar for medical services. If they don't, they have to do a rebate. It's the law that they want to repeal. Okay, $1.1 billion. 105 million Americans, including 71 million Americans in private plans and 34 million seniors in Medicare, have received access to free preventative services. You want to hold down the cost of medical services? Do prevention. The Affordable Health Care Act requires that every insurance policy, including Medicare, provide a free medical checkup every year. Guess what has happened? The cost curve has bent downward. Why? Because serious illnesses are either treated or delayed. Diabetes, strokes, heart conditions are analyzed early and treated, reducing the cost of health care and, far more important, keeping people alive and healthy. Moving on. 30 million women are receiving free coverage for comprehensive women's preventative services, including a well woman visit and diabetes screening. They want to repeal that. 30 million American women receiving free diagnostic care. They want to repeal it. 17 million children with pre-existing health conditions can no longer be denied coverage. I was an insurance commissioner. I cannot tell you the number of times that I begged for a law that would require insurance companies to continue or to provide insurance for a newborn child that had a serious illness. Time after time in California. Insurance companies would insure the mother for the delivery, and the moment that child was delivered, the child had no coverage. Bankruptcies and lack of medical care ensued. 17 million children will be denied health care coverage if they are successful in repealing the Affordable Health Care Act. 17 million children. 6.6 million young adults to the age of 26 have taken advantage of the Obamacare law, the Affordable Health Care Act, to stay on their parents' health insurance plan. Do you have a kid in college? Do you have a kid that's graduated from college that's 21 or 22? They can stay on your plan. Before the Affordable Health Care Act, before Obamacare, they had very little opportunity to get insurance. They'd have to go out and buy their own policy. They were able to stay on their parents' policy. 6.6 million young adults that will not be insured if they are successful in repealing the Affordable Health Care Act. 100 million Americans no longer have a lifetime exclusion. Previously, most health insurance policies in the United States set a limit on the amount of coverage that a person could have during their lifetime or in a given year. 100 million Americans no longer have a lifetime exclusion. 100 million Americans are able to get comprehensive coverage for the duration of their illness. They want to affect the well-being of 100 million Americans. You've heard about the senior donut hole, the drug coverage. Written into the law in 2003, providing drug coverage for seniors, Medicare Part D, was a donut hole. You got the first couple of $1,000s covered. After that, 100% of the cost had to be paid by the seniors. The Affordable Health Care Act is shrinking the donut hole every year. And in another 2 or 3 years, that donut hole will be closed, providing an extraordinarily important benefit to seniors. I know this problem in my communities. Before the Affordable Health Care Act, before Obamacare, seniors would reach that donut hole threshold, and they could not afford to continue to buy their drugs, their pharmaceutical products. So what did they do? Their blood pressure went up, their diabetes was not treated, and they became seriously ill. They want to repeal the Affordable Health Care Act, and the donut hole will not be closed if they are successful. Shall we continue on? In California, on October the 1st, 4 million Californians for the first time will have access to an insurance exchange, a marketplace, a free marketplace, which we talk about all the time. But one does not exist in California until October the 1st, where the uninsured in California, including this member of Congress, will be able to go to a rational marketplace that lists numerous health care policies, 5 different levels of coverage, all of them uniform, all of them priced, where I and 4 million other Californians can select the policy of our choice. Not a government policy, but a private insurance company policy. A marketplace, a free market solution to the 40 million Americans that are not insured and the 4 million in California that are not insured today. We rail back and forth, Democrats and Republicans alike, about the necessity of a free market, and for the first time ever in this nation, a free market, rational market system is established, not only in California, but in every state in this union. And 33 state governors have refused to set up a free market, rational system called an exchange. Called an exchange in which insurance companies will lay out their policies, lay out their price, lay out their coverages, exclusions, and the rest, and the public will be able to have price information, quality information, and make a choice. That's what's called a free market. And they want to repeal it. So what are those people to do? Yeah. 435 of us represent the people of America. I spent an hour listening to some 20 people who may, in their own, believe that they're representing their people. But I know from my experiences as insurance commissioner in California that for the first time across this nation, we have the opportunity to have a market system, a health insurance market system that is rational, that is sensible, in which prices are available, in which quality and multiple products are available. Not a government-run health system, but rather a market system established by this government so that the people of this nation can pick and choose which private policy they want. If you're over 65, you can get your Medicare, and you will continue to get it with the additional benefits that are in the Affordable Health Care Act. If you're not yet 65, and you happen to have been unemployed at the age of 50, prior to the Affordable Health Care Act, you were in the deepest of trouble. You were virtually uninsurable. Why? Because you were 50 years of age. You were entering that period when you were expensive. You were likely to get health issues. Insurance companies routinely discriminated against you. And if you happened to be a woman, you were in even deeper trouble. Those days are gone. Unless the Republican Party succeeds in repealing, delaying, defunding the Affordable Health Care Act. The American people have an opportunity today to get insurance, or they will on October the 1st. Exchanges will operate across the country. Some run by states such as California and New York, where the governor said, this makes sense to the people in my state, and we're going to do it. Others, like Texas and Montana, the governor said, oh, we don't care about our people, and therefore the federal government is stepping in to set up the exchanges. Whatever you may have heard over this last hour about a government-run health care system, it is not true, except if you happen to be on Medicare. Medicare is a government-run health insurance program in which the delivery is not provided by the government but provided by multiplicity of health care providers. Individual doctors, group of doctors, hospitals, big health care medical centers such as the University of California, San Francisco. Yes, Medicare is a government health insurance system. It is not a delivery system. There is one, however. It's called the U.S. military hospitals, and veterans hospitals. Those are government delivery systems. So whatever you may have heard about the government takeover of health care, not true unless you happen to be in the military, a veteran, or on Medicare. Even the Medicaid program is state-run, not run by the federal government. Oh, there are so many falsehoods. You could fill this entire room with the falsehoods that we've heard over the last months. But the reality is that the Affordable Health Care Act is good for America. It is reducing the inflation rate in health care. We've already seen the lowest inflation rate in the last 3 years since the enactment of the Affordable Health Care Act than over the last 25 years. So, are we going to shut down government so that the opponents who failed in an election, who failed in Congress in 2010 to stop the Affordable Health Care Act, failed in a presidential election, in Senate elections, are we going to shut down government so that they can leverage something that they could not achieve in an electoral process? I don't think so. I don't think the American government will stand for it. I don't think the American people will stand for it. I wanted to talk about jobs. I wanted to talk about my district. I wanted to talk about the necessity of a farm bill so that there will be food on the table for the poor, so that there will be a program that the farmers in my district will know what they will face as they begin to plant their winter crops. That bill languishes because of this process that we're seeing. I wanted to talk about a transportation bill that we must write and fund so that we can build the infrastructure, so that we can put people back to work. But no, we're caught up here in this process. There are things that we need to do in America. And here we are. Here we are. This is not good for America. The Affordable Health Care Act is good for Americans. And when we provide health insurance for every American, we will be a much more just society. And we'll have a stronger economy. This road's out ahead of us. I'm going to be joined by my colleagues. I'd like my colleague from Florida to join us here. Federica Wilson, would you please join us?
Thank you for sharing this hour with me. Representative Garamendi from California, my dear friend. Mr. Speaker, who could be against making every American eligible for health care insurance? I can't even imagine. So I'm here today to help set the record straight about Obamacare. I'm here to explain what Obamacare means to the people in my community and the people around this nation. And I'm here to explain the truth, the real truth behind the health care reforms that are moving ahead on Tuesday, October 1st, simply because Obama cares. Mr. Speaker, this health reform is about making it easier and cheaper to get insurance if you don't have it. It's that simple. Our President, Barack Obama, cares and is making health care easier to obtain. He cares and is making health care more affordable. President Barack Obama cares and is making health care more accessible. Now listen up. If you have Medicare, this does not apply to you. This has absolutely nothing to do with you. It will not affect your coverage. If you have Medicaid, this does not apply to you. If you have a job with health care coverage, this does not apply to you. Obamacare only applies if you do not currently have insurance. You will finally have the opportunity to gain protection for your body. You will finally find peace of mind. You no longer will have to fear of being bankrupted by a health emergency. You no longer will have to let your health suffer by avoiding the doctor. You no longer will have to fear for your family going without care. Mr. Speaker, there are very few simple steps for getting started if you're uninsured. Because Obama cares, you can get started with these simple directions. If you have access to the internet, you can get started right away. Beginning Tuesday, October 1st, healthcare.gov will give you all the information you need to sign up for this program. Once you're there, go to the tab that says Get Insurance. Mr. Speaker, this will take you to a page that will explain all the insurance marketplaces available to you. You will be able to compare all the plans available to you in your area. Mr. Speaker, the internet is the best way to sign up. But if you're not comfortable using a computer, ask a friend or ask a young relative to help you survey the choices. Young people know all about computers. If you need additional help, you can also call 1-800-318-2596. People are available around the clock to offer assistance in more than 150 languages. And in Miami, that is very important. They can help you enroll by mail if you prefer. Mr. Speaker, Obamacare is so much that there will also be expert advisors called navigators in your community. You can find them at community health centers, at the mall, in drugstores, and in many places of worship. In some states, traditional insurance agents and brokers will be able to help. But remember this, if someone tries to charge you money for advice on how to sign up, say no, because it is a scam. No one should be charged for assistance in signing up. Mr. Speaker, Americans should take their time in completing the important task of choosing the right health insurance plan. I know sometimes it can take 2 hours to choose the right pair of shoes at the mall, or 2 hours at the kitchen table to choose the right cable TV plan. Be patient. Take your time in choosing the right plan to protect your body and your life. You won't regret it. Mr. Speaker, Obamacare is because health reform is not only about making insurance simple, but also making it affordable. Let me just give you a couple of examples. A self-employed person with a spouse and 2 children and a household income of $33,000 would more than likely not be able to afford insurance at all today. But starting Tuesday, October 1st, this person would be able to get insurance for his entire family for an average of $94 per month because of a government subsidy. A single mother with 3 children and a household income of $40,000 will now be able to insure herself and her children for an average of $163 per month through Obamacare. Mr. Speaker, it's affordable and it's essential to be covered. Young people under 26 will be able to stay on their parents' plans. For those young people without the opportunity to join their parents' plans, it's especially important for you to get insurance. If you're young, you're statistically more likely to end up in a car crash or a motorcycle crash, or to experiment with drugs or other risky behavior that lands you into trouble. You need insurance as much or more than anyone else. You have to pay to insure that car. You have to pay to insure that motorcycle. So make sure that you pay a very small portion of that first paycheck you earn to insure your precious body. Mr. Speaker, no one said this would be easy. There will be challenges as the federal government implements the new insurance markets in 36 states in the weeks ahead. But progress is never easy. Nothing this important and ambitious is easy. There will be needed tweaking and needed corrections, but that was also the case in 1935 when we rolled out Social Security, and in 1965 when we rolled out Medicare. Mr. Speaker, we know that Obamacare is because insurance companies can no longer deny 17 million children with pre-existing conditions their health coverage. We know that Obamacare is because 105 million Americans with life-threatening diseases like cancer no longer have to live in fear of maxing out of their lifetime dollar limits or their insurance coverage. We know that Obamacare is because more than 3 million young people up to the age of 26 now have coverage because insurance companies can no longer remove them from their parents' plans. Yes, Mr. Speaker, we are well on our way to a healthier, more financially secure nation. We utterly refuse to allow anyone to damage, repeal, or turn back Obamacare. It is the law of the land, and it is here to stay. We will stand up for those who cannot stand up for themselves. We will speak out for those who cannot speak for themselves. We will do all this and more because President Barack Hussein Obama cares. He cares for the people of this nation. I yield back the balance of my time.
Thank you very much, Ms. Wilson. Thank you for laying out the way in which the Affordable Health Care Act will benefit and how people can use that act, how they can access the exchanges and the benefits that are found in it. I'd like now to call on one of my colleagues from the Midwest, Mr. Ryan, if you would care to join us. Thank you.
I thank the gentleman. I thank the gentlelady. This is obviously a very important issue for all of us around the country, in Ohio especially, and we have a very unique situation going on in Ohio. As I heard the previous special order, heard many members of the Tea Party caucus come up here and talk about how bad the Affordable Care Act is, how it is going to end democracy as we know it, how the sky is going to fall, and it is troubling, I think, when you actually see what the benefits are. And let me be the first to say, as I think even those of us who voted for the health care reform, there's a long way to go. We've got a lot of work to do. These things aren't easy. This is a very complicated situation, a very complicated program to try to cover all 313 Americans, try to drive down health care costs, try to move towards more prevention and wellness. Very big goals in the United States. Goals that we can only really achieve if we work together. So to have one side trying to destroy what is now law in the United States, confirmed by the Supreme Court, passed by the House, the Senate, signed by the President, approved by the Supreme Court. And now as we try to stand it up, we have people trying to inject into the process not a helpful hand, not trying to make it work better, but trying to destroy it, trying to add more uncertainty here in the United States Congress, even to the brink of wanting to shut down the government or default on the credit, the full faith and credit of the United States. All the polls are saying 60 to 70%, maybe in the high 50s of most Americans say, we do not want you to use shutting down the government or defaulting on our debt as a way to try to push back on Obamacare or the Affordable Care Act. So what I'm saying is we have millions and millions of people. Here's what really gets me. People walk up on the other side of the aisle, God bless them, and they act like prior to 2008, 2009, we had a health care system that took care of everybody. Everybody was fine with the current. No businesses were calling our offices saying, man, this health care is destroying my business. I can't plan ahead. It's a 30% increase this year. It's 70 next year. We get one person sick, in a small business of 20 or 30 people, we got to go bankrupt. People forget. Millions of Americans, prior to this health care law, 1,700 families in my congressional district went bankrupt because of health care. So we're not even going to talk about that? Are we going to sweep that right under the rug? The kind of suffering that goes on in some of our communities? We're going to drive around the problem, close our eyes? And everyone else says this is a giveaway. This is not a giveaway. This is about giving people who go to work every day, sometimes 2 or 3 jobs, have a sick kid. We're just going to ignore them because we got this bumper sticker on the back of our truck that has 4 little slogans on it, and boy, we can't deviate from that because we'll get primaried by a Tea Party candidate because we can't check every box along the way. But fine, let those 1,700 families go bankrupt. Let that kid with cancer and his parents who are at Akron Children's Hospital or some other children's hospital around the United States have to deal with the fact that they hit their lifetime cap because their child has cancer. Now, give me a break. Because you gotta stick with that bumper sticker. Can't deviate from the bumper sticker that says less government. We want to go back to that great health care system that left 40 million people without any health care, that kept driving up prices for small businesses, small manufacturers in Ohio. We can maintain what is great about the American health care system. I represent a district not far from the Cleveland Clinic. We understand in Northeast Ohio how powerful it is, some aspects of our health care system. But there are failures in our health care system. And we are here as members of the United States Congress to try to fix those holes in the system and try to help our fellow citizens that may be sick, maybe can't afford it, but go to work every day just as hard as everyone else. And I will say, before I kick it to my friend from New York, that I find it very interesting that we have some governors in some of our states, Republican governors in some of our states, conservative Republican governors in some of our states, Tea Party governors in some of our states. One, in Ohio, was the chair of the Budget Committee during the Gingrich Revolution, Governor Kasich. He makes the exact same arguments for expanding Medicaid in Ohio, which he is fighting for, along with Governor Brewer out in Arizona and some others. He makes the exact same arguments that it is immoral for us to have this level of sickness in our society with people not having access to health care. That it doesn't make any sense for us to wait for somebody to get so sick and then they dump themselves into an emergency room after weeks and weeks of sickness, ending up there much sicker than they should be. He, as well as others, are making the argument that prevention is the way to go. Wellness is the way to go. And I commend these governors because it makes sense. So sit down and work with us to help stand this up, to create more competition, to make sure that these young children and their families don't have to go to bed every night. And this is the last one, now trying to take any help we're giving the congressional staffers, which is floating around here. And I know it's a political hot button, but my goodness gracious, we get young people that want to come to Capitol Hill, live in one of the most expensive cities in the world, make peanuts because they are ambitious and want to get ahead, and we're going to say, you're on your own with your health care too. What are we doing? What are we doing? This doesn't make any sense. And I'm sorry. You know, I'm sorry you don't like President Obama. I'm sorry. You know, I don't know what to say. But to come after health care reform, where so many millions of people are going to benefit. And in Ohio, we're saying 6 out of 10 of the people who are uninsured in Ohio can get health care for less than $100 a month. What's wrong with that? What's wrong with that? Yield to my friend.
Thank you, Representative Ryan, and thank you for expressing the tone of harshness that has prevailed in this chamber. I don't know if I can remember when